Okay, let's unpack this. Moving to a new country like Hong Kong is, well, it's thrilling, right?
Yeah, but
You're thinking about the new job, finding a place, exploring. But something really foundational you absolutely need to get your head around is healthcare.
yeah.
How does it even work? Are you covered? Who do you actually see if you get sick?
It's a big question.
So this deep dive, it's designed specifically for you, the expat, to help make sense of the Hong Kong healthcare landscape.
Exactly. And we're drawing on some really solid material here, actually, particularly from moveandstay.com.
Move and stay.
Yeah, they've got this deep well of experience. They've been helping business travelers and expats across Asia find places to work, places to stay for, gosh, over 25 years now.
Wow, 25 years.
So they really get these practical challenges, the nitty-gritty of relocating, including something as vital as healthcare.
Absolutely. Their insights, they should give us a fantastic roadmap today. Our mission is basically to cut through the complexity, pull out the most important bits of knowledge, and help you feel, well, informed and ready to tackle the system without that, overwhelming feeling.
And here's where it gets really interesting. Straight away, Hong Kong doesn't just have one healthcare system.
Bro.
It has two. It's a dual system. You've got public and private options kind of running side by side.
Okay.
And understanding how they work, how they interact, or some things how they don't interact, that's really the absolute core of navigating healthcare there as an expat.
Right. Okay, a dual system. Let's dive into that then. Tell us about the public side first. What's the setup like?
So the public system is primarily managed by two bodies, the Hospital Authority and the Department of Health.
Okay.
Its main design feature really is accessibility. It's meant to serve pretty much everyone residing in Hong Kong.
Right.
That includes expats, if they hold a valid visa, and, this is important, a Hong Kong ID card, the HKID.
The HKID, okay.
Think of it as the backbone, a huge network of hospitals, specialist outpatient centers, general clinics, all across the territory.
And I gather the biggest attraction here is the cost. Is that right?
Oh, the cost difference is...
It's massive.
Yeah, this system is heavily subsidized by the government.
Heavily subsidized.
So for eligible residents, and again, that includes expats with that HKID, the costs are incredibly low. We're talking figures around HK $50 for a standard public outpatient appointment.
50 Hong Kong dollars for a doctor's visit.
50?
Yeah.
HK $50. It's almost nominal, really.
That is. That's astonishingly affordable.
Oh.
So, okay, what's the catch? There must be a trade-off for that kind of price.
There is. The trade-offs are mainly around time and choice.
Oh.
Because it's so accessible and affordable, the public system, it can be really heavily used. So you should definitely expect queues,
Right.
sometimes quite long ones, especially if it's not an emergency, like for specialist appointments. The whole process, it can feel a bit less personalized, maybe less customer-focused than what some people might be used to in their home countries. And while it covers comprehensive medical needs, like essential maternity services, which is great, routine dental care, generally not included.
Yeah.
Unless it's, a real emergency.
Right, okay. So amazing value if you're eligible and you've got some patients. Covers the big stuff, but maybe not the sort of day-to-day extras are getting seen immediately.
Exactly.
So what's the alternative then if you need more speed or maybe more personalized attention?
That's where the private sector steps in. And it's a really robust, extensive system running alongside the public one.
Okay.
You've got private hospitals, a huge number of specialist clinics, diagnostic centers, the works.
And the main benefits there would be?
Speed and choice.
Yeah.
Absolutely. Waiting times are dramatically shorter.
Right.
If you need to see a specialist quickly or get diagnostic tests done without a long delay, the private route is usually the way to go.
Makes sense.
And you also get much more choice over which doctor you see, which hospital or clinic you go to. A lot of expats appreciate having the option to see, say, doctors from Western countries, if that's their preference.
Yeah.
Or just generally having that wider selection pool. It definitely offers a higher degree of, control and personalized care.
That flexibility and speed, it sounds incredibly convenient. But convenience like that usually comes with a price tag, doesn't it?
It most certainly does, yeah. Private health care is expensive. This is a really critical point for anyone planning a move.
How expensive are we talking?
Well, consultation fees with specialists. They can easily range from, say, HK $800 to HK $2,000, sometimes significantly more just for one visit.
Wow.
Diagnostic tests like an MRI or a CT scan, you're looking at several thousand Hong Kong dollars.
Okay.
And hospital stays, The daily room rate alone can start around HK $2,000 and go way over HK $10,000 a day, depending on the hospital and the type of room.
Oof, okay.
So yeah, this is exactly why having good medical insurance becomes less of an option and more of a necessity if the private system is your preference or if you need that timely treatment.
So, okay, looking at the overall standard of medical care then in Hong Kong, combining both systems, how does it actually measure up? Is it good?
Generally, yeah, the standard is considered very high across the board, really.
Okay.
Facilities, both public and private, they're well equipped, often state-of-the-art, especially in the private sector. And the medical professionals, the doctors, nurses, they're very well trained. Many actually have qualifications from top universities internationally, including Western ones.
That's reassuring.
So you can definitely expect a high standard of clinical care, whichever route you take.
So the difference isn't really about the quality of the doctors themselves. It's more about the accessibility and the model of care.
Precisely. Yeah, that's a good way to put it. The clinical expertise is high in both systems.
Right.
The public system delivers that high-quality care, but it operates in a sort of needs-based triage system for efficiency, which, leads to those weights we talked about. The private system delivers that same high-quality care, but with, immediate access and much more personalized service, but at market rates. So for expats who might have complex health needs or maybe just a strong preference for choosing their doctor and having more control, the private system is often the practical solution, provided, of course, they have the financial means or, much more commonly, the right insurance plan.
Okay, so summing up that dual system, public is low cost, potentially long waits, less choice. Private is high cost, quick access, lots of choice, both generally high quality clinically.
That's a pretty good summary.
Right. So this brings us squarely to the crucial question then. Insurance. What does all this mean for sorting out health insurance?
Sorting out health insurance is, well, arguably it's the most important piece of the puzzle for an expat heading to Hong Kong.
Right.
Given the cost of private care we just discussed, having adequate insurance isn't really a luxury, it's essential planning. You absolutely need to understand your options to make sure you're covered for the kind of care you might need or the kind you'd prefer.
Now, many companies in Hong Kong, they offer health insurance as part of their benefits package, right? Is that usually enough?
It's often a good starting point, yeah. But it is absolutely crucial to look very closely at what's actually included.
Okay.
Yeah. Employer plans, they vary hugely, massively. One plan might cover basic hospitalization, but exclude things like outpatient specialist visits or routine dental work or maybe maternity care.
Ah, okay. So check the details.
Definitely.
Okay.
And if your employer's plan has gaps that are relevant to you or your family's needs, then topping it up with your own personal private policy is a very, very smart move. It fills those specific gaps.
And something else to think about with employer plans. What happens if you change jobs down the line? Your coverage could disappear, right?
That's a critical point, yeah. Your coverage is often tied directly to your employment. Lose the job, lose the cover, potentially.
Right.
Then there's also the choice you need to make between local versus international coverage.
Okay, what's the difference there?
Local plans are usually less expensive. They're designed specifically to cover treatment only within Hong Kong.
Which is fine if you plan to stay put, I suppose. But what if you travel a lot for work or leisure? Or maybe you want the option of treatment back in your home country.
Exactly. That's where international cover becomes pretty much essential. These plans offer much wider geographical coverage. Often it's worldwide,
Right.
though sometimes they might exclude the U.S. just because healthcare costs there are so high.
Right.
It provides a much broader safety net, gives you flexibility if you need care while you're traveling, or if you want the option to return home for a specific treatment.
Makes sense.
And another thing to keep an eye on, particularly with some local plans, is that they can have age limits for renewals.
Yeah.
So that's more of a long-term consideration, perhaps.
Okay. Now, one of the big advantages of private health insurance seems to be that you can really tailor it, right? It's not just a standard package.
Exactly. And this is where you can really make the plan work for your specific situation, your needs.
So you need to think about what? Your health history.
Yeah, definitely. Think about, do you need coverage for any pre-existing conditions? What about routine stuff like dental checkups or new glasses? Optical care? If you're thinking about starting a family, is maternity coverage included? or do you need to add it on?
Hmm.
Insurers generally let you add or remove these sorts of modules.
Right.
It does take a bit of research, a bit of thinking about your own health and future plans, but customizing it means you're hopefully only paying for the coverage you actually anticipate needing.
And the costs for that customization and the overall premium, they can change based on personal factors too?
Oh, absolutely. Age is a primary driver. Premiums generally increase as you get older.
Okay.
Insurers often have different price bands based on age brackets.
Yeah.
The cost will be different for someone age 0-18 versus 26-30 versus 31-35 and so on.
Right.
Things like your smoking status, your past medical history, and of course the specific level of coverage you choose, like the deductible amount. All of that impacts the final premium you pay.
So getting the right insurance is really more than just, a task on the moving checklist. It sounds like it's genuinely about building peace of mind.
It really is. I think that's the core of it. Knowing you've got adequate coverage, it just frees you up, lets you focus on everything else involved in settling in, enjoying life in Hong Kong, without this constant sort of underlying anxiety about what happens if you get sick or have an accident. What about those potentially huge medical bills?
Yeah, takes a weight off.
Yeah.
Okay, so we've covered the system structure, public versus private, and how crucial planning with insurance is. What about the practical side? Like when you actually need to see a doctor, how do you go about accessing services once you're there? Is finding English-speaking doctors difficult?
Generally, no, not really.
Mhm.
Hong Kong is a large international community, and importantly, many local doctors and other medical professionals have actually trained overseas.
Ah, yeah.
So fluency in English is very common, especially in private practice and in the main urban areas.
And where do you start looking?
Good first steps are often just asking colleagues, maybe friends who are already there.
Whew.
Your insurance provider will also usually have a network list of doctors and clinics they recommend or cover.
And I saw in the material there was mention of a really helpful resource. The government actually provides some kind of directory.
Yes. And this is one of those really practical nuggets that can make navigating the system feel much less daunting when you first arrive.
Okay.
The Hong Kong government runs an online search portal that's for registered medical practitioners. And what makes it so incredibly useful is the ability to filter your search.
How so?
You can search by the type of doctor you need, like a GP or a specialist, a dentist, even traditional Chinese medicine practitioners. You can filter by gender, if you have a preference, by hospital affiliation,
Yeah.
and crucially, you can filter by languages spoken.
Oh, that's brilliant. Filter by language.
Yeah. And you can often find contact details, see their qualifications, check if they're in public or private practice, and sometimes even get an idea of a basic price ranges or payment methods they accept.
Wow, okay. Being able to filter by language, maybe get a rough idea of price up front. That really takes some of the guesswork and, frankly, the anxiety out of finding someone suitable when you're new in town.
It genuinely simplifies that search process enormously. It kind of empowers you, to find a practitioner who meets your specific needs and preferences right there from your computer or phone.
That sounds incredibly useful. Okay, what about if you need more specialized medical care? Say you need to see a cardiologist or an orthopedist or something like that. How does that work?
Well, Hong Kong generally has very high-quality specialist care available. The usual route, especially if you're thinking about using the public system or maybe if your insurance requires it, is to get a referral letter first from a general practitioner, a GP.
Okay.
That letter is typically valid for about 3 months.
Right. But can you just bypass the GP sometimes? If you know you need a specialist, can you go straight there?
You often can, yes,
Hmm.
particularly in the private system. This is usually called self-referral.
Uh-huh.
However, it's often pricier than going via a GP referral. And like I said, some insurance plans might actually require that GP referral for them to cover the cost. So always check your policy.
Good tip.
And again, just like with general care, both public and private hospitals offer specialist services. And, no surprise here, waiting times are the key difference.
Right. Private
Uh,
faster, public slower.
Exactly. Private means significantly quicker access, but you'll pay that premium cost. Public is much more affordable, especially if you have your HKID.
Yeah.
But the waits for non-urgent specialist appointments can be, well, considerable. Weeks or even months sometimes.
Okay.
So again, it's really vital to check your private medical insurance policy to confirm what it covers in terms of specialist consultations and any tests or treatments they might recommend.
Okay. Good advice. Now let's consider the worst case scenario, an emergency. I don't know, twist your ankle badly while hiking or something more serious happens suddenly. What's the procedure then?
Right. For any medical emergency, the number to dial is 999.
999. Okay.
That's for an ambulance, just like, 911 or 112 in other places. And an important point, all ambulances in Hong Kong, regardless of where you are or what insurance you have, will take you to a public hospital's accident and emergency department, the A&E.
Ah, okay. Always public for emergencies initially. Do you need to be registered or anything?
No, you don't need to register beforehand for emergency care. You just go where the ambulance takes you.
And how do they manage the flow? Is it first come, first served in the emergency room?
No, they use a triage system, which is standard practice globally, really.
Right.
It means you'll be assessed by a nurse pretty quickly upon arrival, and then your waiting time depends entirely on how critical your condition is judged to be.
Okay.
They usually categorize patients into about 5 levels, something like critical, emergency, urgent, semi-urgent, or non-urgent.
So even in the A&E, if your problem isn't deemed like immediately life-threatening.
Exactly. If you're assessed as semi-urgent or non-urgent, you can still face a significant wait, even though you're in the emergency department.
Right. Is there a charge for the ambulance service itself?
Yes, but it's very nominal, around HK $180, I believe.
Yeah.
Which is incredibly low considering the service.
Okay.
But it's also really important to be aware that there are quite serious penalties for misusing the $9.99 emergency service.
Oh, like what?
Things like a HK $2,000 fine, or potentially even up to 6 months in prison if it's deemed improper use.
Wow. Okay, so they take that seriously. It's clearly only for genuine emergencies.
Absolutely.
So knowing the location of your nearest hospital with an A&E and having that 999 number saved in your phone,
Yeah.
definitely a smart move for any expat.
Absolutely. Basic preparedness, really.
Yeah.
But, healthcare isn't just about dealing with illness when it happens or emergencies. Maintaining your general well-being, especially in a new, often fast-paced city like Hong Kong, is incredibly important, too.
Yeah, that makes sense.
It's easy to get caught up in the energy the work demands, but finding some balance is really essential if you want to actually thrive there, not just survive.
Healthy eating must be a challenge sometimes with all the amazing, tempting food options everywhere.
Oh, it really can be. Delicious, but maybe not always the healthiest. The source material wisely suggests just being mindful, making conscious choices.
Like what?
Simple things, really. Cooking more at home gives you control over ingredients. Exploring the local markets, like the really vibrant wet markets for fresh produce, can be great. And when you're eating out, actively look for healthier options like salads, soups, steamed dishes. Small habits can make a big difference over time.
Okay. And air quality. That's another factor people often mention about living in big Asian cities.
Yeah, it can be a concern on certain days in Hong Kong. Again, the advice is about taking sensible precautions.
Gotcha.
Check the daily air pollution index. There are apps for that.
Huh.
Avoid really strenuous outdoor activities on days when pollution levels are high. Maybe hit the gym instead of going for that run outside.
Right.
And consider getting an air purifier for your home, especially maybe for the bedroom where you spend a lot of time. These are just practical steps to, litigate potential impacts.
Makes sense. And what about the notorious Hong Kong work culture? People often talk about long hours. Balancing work and life must be a constant effort for many expats.
It is, yeah. That's a very common challenge people face. The key seems to be making a conscious effort.
How?
Scheduling regular breaks, even just short ones, to step away from your desk or workspace. Actively carving out time for hobbies and activities you actually enjoy. Whether that's hiking in the amazing country parks nearby, joining a yoga class, finding a creative outlet, whatever helps you decompress.
Mm-hmm.
And setting boundaries, real boundaries between work and personal time. Like deciding you're not checking emails after a certain hour or protecting your weekends. That's crucial for mental space.
Yeah.
And the source also makes a really important point here. It's okay to take time to adjust. Moving countries is huge, and it's perfectly fine and actually healthy to seek support if you find yourself feeling overwhelmed by the transition.
And speaking of support, mental health is just as vital as physical health, isn't it? Especially when you're navigating all the stresses of relocating.
It's absolutely crucial, and sometimes it gets overlooked in all the excitement and logistics of moving.
Yeah.
Feeling anxious, maybe a bit isolated, or even down as you adjust to a completely new culture, a new environment. That's actually pretty normal.
So what support is available?
Hong Kong does have mental health services available. The source suggests taking proactive steps, like seeking out a therapist or a counselor. Ideally, maybe find one who understands the specific challenges of expat life.
Okay.
Joining expat groups can also be great for building a social network, connecting with people who are going through or have gone through similar things, and just reinforcing those basic well-being pillars we talked about, trying to prioritize sleep, maintain reasonably healthy eating habits, finding effective ways to manage stress.
So the resources and support systems are there if you look for them, and it's important not to hesitate if you feel like you need that help.
Exactly. Taking care of your mental and emotional well-being, thinking about it holistically, it really contributes significantly to having a successful and ultimately a happy expat experience.
Okay. Finally, let's circle back and focus purely on the financial angle of healthcare again. Planning for the costs seems absolutely non-negotiable, especially thinking about those private sector expenses.
It truly is essential financial planning. Non-negotiable is a good word for it. Understanding the structure is the first step, as we discussed.
Right, the subsidy.
Those heavily subsidized services in the public system. Incredibly affordable if you meet the eligibility criteria, mainly having that Hong Kong ID card and the right resident status.
But if you don't, or before you get your ID.
Then the costs, even the public system, can be significantly higher, sometimes much closer to private rates for certain non-emergency services.
Okay. And estimating those private treatment costs, as you said, is tricky because they vary so much.
They vary wildly.
Yeah.
Depends on the specific doctor, the clinic, or hospital, the complexity of the treatment. Just to reiterate the kind of scale we're talking about, that HK $800 to HK $2,000 plus for a single specialist visit,
Yeah.
thousands for scans, potentially over HK $10,000 per day just for a private hospital room. These figures really hammer home why robust insurance coverage is just so important.
So getting cost estimates up front is key if you go private.
Absolutely. It's always wise to try and get a detailed cost estimate from the provider before you undergo any significant private treatment, if the situation allows, of course. Avoid nasty surprises later.
So managing healthcare costs as an expat in Hong Kong, it really boils down to prioritizing getting adequate health insurance. Is that the main takeaway?
I'd say it's the absolute cornerstone of financial planning for medical needs there, yes.
And remembering the costs go up.
Yeah, factoring in those age-related increases in premiums we talked about, it's important, especially for longer-term budgeting.
And it's not just the premium.
No, exactly. Beyond the premium itself, remember to consider any potential out-of-pocket expenses your specific policy might have. Things like deductibles you have to pay first, or co-payments for each visit, or specific services that might not be fully covered.
Right.
It's probably wise to try and set aside a small emergency fund just for unexpected medical bills or costs that your insurance doesn't cover. A little buffer.
Good idea.
And, importantly, don't just sign up for a policy and then forget about it. Regularly review it maybe once a year, just to make sure it still meets your needs, especially if your family situation or health changes. And make sure you understand which hospitals and clinics are actually in your insurance network to avoid issues.
So, okay, there you have it. Getting your head around healthcare in Hong Kong as an expat. It can feel complex initially, can it? Balancing public, private, figuring out insurance, knowing how to find doctors, managing the potential costs.
It seems like a lot.
It does, but by actively engaging with this information, understanding the nuances we've talked about, and really planning ahead, especially when it comes to insurance and financial preparedness, you can make the whole process feel much smoother, much more manageable.
Definitely.
It's really about feeling secure and prepared, isn't it? So you can actually focus on settling into and enjoying life in what is, by all accounts, a really vibrant and amazing city.
Absolutely. And this deep dive, leveraging insights from sources like moveandstay.com with their long history of actually helping expats on the ground,
Yeah.
it's really highlighted those critical elements, hasn't it?
Yeah.
Understanding that dual public-private structure, the almost non-negotiable role of good insurance, the practical steps for actually accessing services when you need them, the importance of looking after your holistic well-being, mental and physical, and the need for that sound financial planning around it all.
It really underscores that while Hong Kong's system is high quality overall, proactive preparation from the expat side is absolutely key.
It is. You need to engage with it.
Which raises an important final question for you, our listener. How might proactively engaging with resources like that government medical practitioner directory we mentioned, understanding the cost differences between public and private upfront, and really taking the time to tailor your insurance, how might doing that groundwork not just provide practical help, but fundamentally change your actual experience of settling into and feeling truly secure in Hong Kong?